is Jessica DeMassa at the HISA Studio here at HIC 2017. I'm here with Emma. Emma, can you please introduce yourself for everybody watching?
Sure, Emma Hossack's my name, and I'm the president of the medical software industry in Australia. I'm also the CEO of Extensia, which is a community shared health record company. And we have a couple of projects running in Australia, one in Gold Coast, which looks to solve the problems of integrating hospitals and GPs, big problem in Australia,
Right.
and one in West Australia, which deals with bridging the gap for aged care between hospitals and primary health care.
Okay, so both of those I know are tremendous issues here in Australia. And so let's talk a little bit about how you're bridging that gap in care with aged care. I feel like we haven't really spoken about that. So tell me a little bit about what you're taking on there. What challenges are you trying to solve?
Essentially, we're trying to stop older people having to leave home and go into hospital where they don't need to. And often it's simply the lack of information that their providers are given and the hospitals are given that ends up in them staying several days in hospital, costing a lot of money and actually making their health worse.
Okay.
So by giving people the right information at the right time, in real time with dynamic data, and allowing the people who are looking after them to see that information, you can actually stop them going to hospital in the first place in many instances. And when they go there, the stays can be shorter because a lot of the information hospitals need doesn't have to be redone.
That's fantastic. So I know there are a lot of others who are out there implementing similar systems. So what advice would you give them for kind of creating that climate of, I guess, shared data to help improve health outcomes, help keep people at home who are aging? What advice would you give?
Well, ironically enough, one of the biggest blockers for digital health in Australia is people's attitudes to privacy. And it's not actually worrying about them sharing it, it's often the providers who think that they can't share information. So I think that getting a very clear understanding of the fact that information can be shared as long as the patient is happy to share it with their providers would be absolutely brilliant, because at the moment people are thinking, God, if I share that, is that illegal? All of those kind of things which are absolutely affecting people's health.
Do you think that, is it a lack of understanding of what's legal and illegal, or are there a lack of standards in place that are contributing to that? What's the core issue here?
Well, privacy is really complicated, and so we don't actually have a number of statutes. We have privacy principles in Australia, which means it's a very contextual problem, and that means it's very hard to understand, because what's right in one situation won't be right in another one. So that's complex, and you've got very, very busy professionals here who haven't necessarily got the time to work through all of those things. So I think for industry, it's our duty to provide them with robust systems which are secure and pro-privacy, privacy by design, to assist them managing that very difficult area of privacy and security.
So we talked for a minute here about the blockers, and so for uptake of digital health and sharing of data. What do you think are some of the enablers? What are you seeing as things that are really starting to help catapult the transformation of healthcare in this way?
Well, once you've got the trust, and that's what we were talking about before, I think then you've got people realising and willing to take really, God, sorry about that.
Oh, it's okay.
Okay, then you've got people willing to take, I suppose, the same approach they take with all other aspects of their life, like banking, general legal advice,
Sure.
all of the things that they currently share fluidly, they can start seeing the benefits of doing that with health. And that's what our industry is about, making sure that all of the people get the right information in the format they need it, where they need it. And at the moment, that doesn't happen as much as it should.
What has you most excited for the future? I mean, there's a lot of great technology that's around. I mean, in your role, I mean, you're in your dual role, really. What are you most excited about?
I'm excited about the fact that industry now has been invited to work with the government to develop the standards that will allow us to do all the innovation and all of the other kinds of projects which in the past have been possible, but we've had no really clear rules around where we were to go, where the government was going to tread. So the market has been messy, and I think now there's an agreement between industry and government to work together to very clearly define what our particular roles are. So the government can provide us with basic infrastructure, and we can then provide the really smart bits that go on top of that.
Fantastic. Well, Emma, it was lovely to speak with you. Thank you so much for joining us here in the HISA Studio. I'm Jessica DeMassa at HIC 2017. Thank you.